Hey everyone, my name is Dr. Jesse. I'm a dentist here in Melbourne, Victoria, here to answer commonly asked questions on the internet when it comes to oral and dental health. The first question is, should I brush before or after breakfast? Technically, both are fine. If you're brushing before, it doesn't matter how long you brush before, how early you brush before you actually eat. But if you're going to brush after your breakfast, you want to wait at least 30 minutes. This will allow the acids in your mouth to settle before brushing your teeth. Whenever we eat anything, our mouth is generating more acidic saliva for about 30 minutes after we eat. You don't want to be brushing your teeth and enamel in more acidic saliva. Question 2, why does my breath smell? There could be a number of reasons. Commonly, you've got gum disease, dehydration, or tooth decay. Tooth decay causes a bad smell because the bacteria fermenting and breaking down your tooth as it starts to rot causes that foul smell. Gum disease causes a bad smell because of the sulfur compounds that the bacteria release. Some forms of gum disease you can actually smell. Sometimes you don't even have to look into someone's mouth to know they've got gum disease because of the strong smell. That's more typical in cases of advanced gum disease. The other reason is that we're dehydrated. If we're dehydrated, we've got less saliva in our mouth, less clearance of bacteria and fungi, and a higher concentration of that bacteria, which creates that bad smell. Question number 3, this one's for the parents. When should I take my child to their first dental visit? As soon as you see those teeth come through, whether they're partially through or fully through, whether it's 1, 2, or 3, as soon as you notice them, bring them in to your next dental visit with yourself. You want the child to feel comfortable, slowly acclimatize to the dental environment, and if they see you there, someone they're very comfortable with, they're going to be more likely to be happy to sit in the chair when they come for their future appointments. We're not necessarily going to do any treatment, we're probably not even going to try to clean. It's more just to get to know the patient and get them comfortable with the dental rooms. Question number 4, this is a very common one I get from all my patients. It's, should I use a manual or electric toothbrush? Technically, both are fine. It's how you use it, and I really want to make sure that you're using a soft bristle toothbrush. Whether it's electric, whether it's manual, make sure those bristles are soft. Otherwise, you might contribute to gum recession where the gums shrink away, or you might even erode your enamel if you're brushing too hard. The final question for today is, why do I need dental x-rays? X-rays allow us to see underneath the tooth surface where we might not be able to observe clinically. Now, we can see a lot just by looking, by using our instruments to feel around the tooth, by pressing around the gums. We can actually detect probably most of decay that way. But there's always that sneaky little bit of decay that's occurring just between two teeth that we can't detect visually or clinically. This is where x-rays come in handy. Have a look at this picture. From the outside, this tooth looks perfectly fine. Yes, there's a little bit of staining, but it's only when we took the x-rays that I saw that there was a huge cavity forming in between the teeth. And lo and behold, we open up this tooth and there you see it. You can see the brown, mush, soft tooth decaying away. I never would have known this was there, especially since the patient didn't have any symptoms or couldn't feel pain. I never would have seen it and never would have been able to treat it unless I had taken an x-ray to begin with. Now, we don't have to take x-rays all the time. It actually depends on your risk. Sometimes we take them every 1.5 years, 2 years, 3.5 years. It all comes down to how often we're getting cavities and what risk we are. If you're a low risk, every 3 to 4 years is a perfectly reasonable time to update x-rays to check for anything that might be brewing so we can catch it before it causes a real problem.